Hello. Today we are talking about umbilical cord care. Do you know the umbilical cord? When the babies are in the womb, there is this cord that attaches the baby to the mother. That is what is called the umbilical cord. At birth, the umbilical cord is cut to separate the baby from the mother. But when it is cut, a stump is left on the baby. How do you care for that stump? That is what we are talking about today. If this is your first time visiting our channel, we hope you have subscribed. If not, please do so now. Hit the notification button as well because here we talk about everything and anything that's related to the health of your baby. And if you don't find what you are looking for, just leave it in the comment section and we will do a video on it for you. Or if it's a question, we will answer it for you. So the umbilical cord must be cared for in a certain way because it is a place where germs can pass through and enter the baby's body. And we know that when babies are small, their immunity or their ability to fight germs or infections is not very well developed like that of adults. That is why we need to care for the umbilical cord very well. However, the guidelines or what you should do for your baby's umbilical cord varies from country to country. I've had clients who delivered maybe a first baby outside and they were told something and then they came to where I work and then we tell them something different and they are confused. But that is simply because the guidelines are made based on the things that happen to babies in that country. In some countries, parents are told to leave the cord alone. Don't dress it, don't touch it, don't do anything to it. And that is what you are supposed to do. Those are countries where they do not have high rates of infections among newborns, and especially infections of the cord are not high among newborns. But we have very high rates of infection of the cord in sub-Saharan Africa, and so we dress our baby's cord. So don't be confused by this. Now, before we come to the dressing of the cord, another thing you should note about the cord is that when air blows on it, or at least when it is not very covered, then it dries faster and then it will fall faster. So when you wear your baby's diaper, make sure that the cord is out of the diaper. Make sure the cord is not in the diaper because when the cord is in the diaper, there isn't a lot of air going there. And also, the cord can be contaminated by the baby's poo or toilet and the baby's wee or urine. So the cord should be out of the diaper. And then wear loose clothing for the baby so that the cord is not so constricted, so that there's a bit of air that can circulate around the cord to prevent a cord infection for you. The cord will fall off. So you need to be patient. Sometimes parents are in a hurry for the cord to fall off. So they actually attempt to try and make the cord fall off themselves. Please don't do that. Leave the cord to dry out and heal naturally, and then it will fall off. Because in a lot of cultures, the cord must fall off fast so that the baby can go out and so on and so forth. But please, you let the cord take its own time to heal and then it will follow. In Ghana, in previous years, we were dressing the cord with methylated spirit. So what you do is that you get some sterile cotton from the hospital, or when they are discharging you, they give you a sterile pack, and then you wash your hands very well. You soak this sterile cotton in the methylated spirit and you use it to wrap around the cord. What you do is that you clean the cord from the base upwards. You clean it up in about 4 different sides, and then you come and clean the cord stump, the cord clamp. That is the thing that is used to clamp the cord when the cord was cut, and then you throw away your cotton wool. Anytime you clean, you throw it away, you take a new bit of cotton wool. Now we are using chlorhexidine gel. Take note that there are various chlorhexidine preparations. So you use the one that has been supplied to you by your hospital pharmacy or your midwife or wherever your doctor says you should get it from. So now we use chlorhexidine gel. The main difference is that when we're using spirits, the cords were falling off a bit faster than chlorhexidine gel. And then when you use spirits, the cord dries out fast. It becomes dark and shriveled and very dry. But when you use chlorhexidine, you don't get the same thing. The cord is not so shriveled, and then there is a yellowish tinge to it. It is not dark like when you're using spirit. And like I said, it takes a bit longer to follow. But definitely, if your cord is falling off after 3 weeks, you need to seek the doctor's opinion. Previously, we used to say 2 weeks because there are certain problems in the babies that can cause delayed falling off of the cord. But now with chlorhexidine, we notice that cords are falling off a bit later than they used to fall off when we were using spirit. So that's something to it. Even though I said that with chlorhexidine used now, the cord has a yellowish tinge. It is never wet. So the cord, if it is wet, is a problem. It is never smelling bad. If the cord is smelling offensive, it is a problem. If there is a bloody discharge at the base of the cord, it's a problem. Or if the base of the cord is red, that is also a problem. All this could mean an infection and so should be seen in hospital. Don't use the warm compress or hot water to press on the cord. Don't do it. When you do that, you're probably just going to introduce infections. We want the cord to dry out fast. So don't do anything that you have not been asked to do. And definitely don't use any other thing apart from what was prescribed for you. And there are cultures that use so many things to dress their cord. Toothpaste, cow dung, all these things. Don't use them on the cord. But follow the guidelines specific to the country in which you had your baby and what the healthcare workers have told you. So, how are you dressing your baby's cord? Or what has been your experience? What did you do for your baby? We would like to know in the comment section. We hope you have enjoyed this video. If you have questions, leave them for us. We'll definitely attend to them. Thank you. Bye.